He's live tonight after getting answers at Hartford Hospital. Mike.
Mark and Aaron, I was here a year ago when doctors got those first doses, and I still remember the excitement from everybody who was here about having the vaccine, but we're still very much in this pandemic as cases continue to rise. So I asked these doctors, what are we doing to get more people vaccinated?
It's surreal because it's been quite an emotional roller coaster.
Dr. Melisha Cumberland reflects on being one of the first people in Connecticut to be vaccinated against COVID. A year ago today, medical workers got the first doses of this new tool against COVID. And today, doctors say getting people vaccinated remains a priority.
That's still our number one weapon in our toolbox that's available to us today.
Cases are going up again this winter, even though Connecticut is one of the most vaccinated states in the country. So what signs are showing that the vaccine works?
But the hospitalization rates last year were far higher than what we're seeing now. And I think a lot of that is attributed to the impact of the vaccine.
Early studies indicate that vaccines may be less effective at stopping an infection from the Omicron variant, but they can still offer protection from serious cases. So what are doctors doing to get vaccination rates up?
We all have to continue to do work to educate people around us.
Doctors are also waiting for the federal government to approve 2 pills that could treat COVID patients. What role will these pills play?
So there's great hope that these pills, which seem to be quite effective when given early in the course of COVID-19 disease, might be broadly effective.
Meanwhile, the Omicron variant continues to spread around the world. Only a few cases have been detected in our state, but doctors think it could become more common. So what do we know about the severity of Omicron?
What we're seeing is, even among unvaccinated people, a lower rate of hospitalization and death.
Now, I also asked some doctors about the likelihood that we might need an Omicron-specific variant. They said it's still way too early to tell because first we need to see how transmissible it is and how serious cases are. This is the same approach doctors take when deciding which strain of the flu to vaccinate for each year. Live from Hartford, Mike Savino.